The award is named for Dr. Sidney Carter, who is really, in some ways, one of the people who established child neurology as its own field, its own specialty. He was instrumental in actually obtaining federal funding for the very first child neurology programs. He worked with others to have child neurology certified as its own subspecialty by the American Board of Psychiatry and Neurology. And so these are the things that really solidified child neurology as its own entity. And so to be the recipient of an award named for a person who did so much for the field, had leadership in so many organizations in neurology, president of the American Academy of Neurology, president of the American Neurological Association, president of the board of directors for the ABPN, it's an incredible, incredible honor.
As someone who is so tapped in with the space yourself, can you just talk a little bit about some of the advances that you've seen in terms of pediatric neurology over the last few years?
There are so many. It's hard to know where to start. I think, when I entered the field of child neurology, I was excited about it because I thought it was a field that would evolve and change during my career. I don't know that I expected it to change so quickly. So just in this last decade, we've seen all of these amazing advances. Spinal muscular atrophy, especially the infantile onset forms, SMA1, has had such a challenging course. It's such a devastating diagnosis, and we didn't really have anything but supportive care to offer for so long. And now we have multiple therapies, multiple impactful therapies for SMA. It's incredible. I think about ceroid alpha that was approved a handful of years ago for CLN2 disease. We've never had central nervous system directed enzyme replacement therapy. We didn't think that was something that could be done. And yes, enzyme replacement therapy is not a new technology, but being able to direct that towards the nervous system impacts of disease is groundbreaking. Whole new route of delivery, whole new way of accelerating treatment. And for CLN2 disease, again, there'd never been a treatment for that condition before. Duchenne muscular dystrophy, many, many treatments available now. So I think we're really evolving as a field. We have always been very skilled as neurologists at being able to observe, at diagnosis, at supportive care, and really supporting patients and families. But now we have all of these new tools that have come along, new medications, new diagnostics, new devices.